So let's start our discussion here looking at the scapula, and we're looking at the anterior view of the scapula here, in which the predominant feature that we'll see here is the subscapular fossa. And then we see the processes, and the most anterior of the processes will be the coracoid process. And then we have laterally and posterior to this, the acromial process, or the acromion. And then lateral and inferior to the coracoid process is going to be the glenoid fossa, which is going to be the articulation point between the scapula and the humerus. We have the supraspinatal or the suprascapular notch. This is important because this is where some blood vessels will be passing through in order to allow for vascularization to some of the rotator cuff muscles. We have two edges of importance here. We have the medial edge and the lateral edge. And these are important as they're going to be attachment sites for some of the muscles that will stabilize the scapula. And then we have our three angles. We have the superior angle, the inferior angle, and then the lateral angle. So now we're going to orient ourselves and look here at the posterior surface of the scapula. We're aware that we're looking at the posterior surface because of a couple of landmarks here. So once again, we have the coracoid process and the acromial process. We can see the glenoid fossa a little bit more detailed here, but the thing that's going to tell us that we're looking at the posterior surface is this structure here, the spine of the scapula. The spine of the scapula is going to be pointing posteriorly, whereas the subscapular fossa is going to be pointing anteriorly, so as to allow the scapula to articulate with the rest of the costals in terms of its ability to move and allow for the movement of the upper extremity, which we'll see when we look at the articulations. Superior to the spine of the scapula, we have the supraspinatal fossa. Inferior to the spine of the scapula, we have the infraspinatal fossa. Once again, we'll have our edges. To the lateral side, we have the lateral edge, and to the medial side, we have the medial edge. And then we have our three angles, our superior angle, our inferior angle, and our lateral angle. So now we're going to look at it from the lateral viewpoint. So what we're looking at is we're looking at the lateral edge and the lateral angle. In this, we have a couple of features that we should be very aware of. One is the anterior process, which is the coracoid process. And then the superior process, which is the acromial process. The acromial process is going to be articulating with the acromial end of the clavicle, with ligaments coming from the coracoid and acromial processes onto the clavicle, forming the acromioclavicular joint. We then see the glenoid fossa more pronounced. Notice how it is a very shallow concave surface that's going to be articulating with a very robust humeral head. And this is one of the reasons why the glenohumeral articulation is as unstable as what it is. Superior and posterior to the glenoid fossa, we get the supraspinatal fossa. This is where the supraspinatus muscle is going to be moving through, as well as tendons of the supraspinatus, infraspinatus muscles. They'll be integrating into the capsular ligaments to form the dynamic ligament that is the capsular ligaments themselves within the rotator cuff. Now, under the inferior edge of the acromial process and at the acromial edge of the clavicle, we have excessively articulated bone. And this excessive articulated bone is covered normally by a bursa. That bursa, due to excessive overhead motions, can become inflamed and can actually roll out of the way, and is one of the leading causes for the development of rotator cuff issues. Inferiorly to the spine of the scapula, we have the infraspinatal fossa. And then on the anterior side, we will see the subscapular fossa. And now these fossas become important because this is where the three predominant muscles of the rotator cuff, along with coming from the lateral edge, teres minor, we develop the entirety of the rotator cuff muscle. So now let's work down the upper extremity into the various bones. We'll start here with the humerus, looking at the anterior side of it, in which we have the head of the humerus. And then we have the neckal region, in which we have two distinct areas. We have the anatomical neck, that is the junction point between the head and the rest of the humerus, the body of the humerus. But then we also have the surgical neck. The surgical neck is the area that we're going to be referencing when we look at orthopedic issues. We then have our tuberosities, in which to the anterior side, we're going to see the lesser tuberosity, and then to the lateral side, we're going to see the greater tuberosity. In between the tuberosities, we have a small groove in the bone. That is the intertrabecular groove. This is important because this is one of the attachment sites for pectoralis major, as well as latissimus dorsi. It's also going to allow for the passage of the long head of the bicep to come about. We also see various tendons of the rotator cuff passing through this, as well as the capsular ligamental region. And this is one of the areas where we get inflammation when we start having rotator cuff issues or bicep tendonitis issues with people who do excessive overhead motions or for older individuals. We then get to the deltoid tuberosity, which is going to be the insertion point for the deltoid muscle. We have the indication for the rest of the humerus, which is simply just going to be the body or the shaft. At the very distal edge of the body, we start to see it splale medially and laterally, and we get the epicondyles, the medial epicondyle and the lateral epicondyle. These are going to become important because they're going to be the attachment sites for the common flexors on the medial side and the common extensors on the lateral side in terms of the muscles of the antebrachium. On the lateral side, we have the capitellum, which is going to be the articulation point for the radius and the head of the radius. And then on the medial side, we have the trochlea, which is going to be the articulation point for the ulna. And so now what we're doing is we're now looking at the same bone, the humerus, but now we're looking at it from the posterior side. And so we have the head of the humerus. We have the deltoid tuberosity or tubercle becoming more pronounced. We will also still see a little bit of the greater tuberosity up at the top lateral edge. We will also still see the nacal regions. We have the body and shaft of the humerus. We have the medial and lateral epicondyles. But we have a brand new landmark to see here, and that is the olecranon fossa. The olecranon fossa is the indentation within the distal edge of the humerus that is going to be the articulation for the olecranon process of the ulna. We have the trochlea,